Hi, everyone, and welcome to the launch of the new High-Level Independent Panel Recommendations and Report happening today during the G20 Summit in Johannesburg. I'm Beth Cameron, Special Advisor to the High-Level Independent Panel and Senior Advisor at the Pandemic Center at Brown University. It's my absolute pleasure to turn it over now to the host and moderator for today's event, Dr. Victor Zhao, the President of the U.S. National Academy of Medicine and co-chair of the High-Level Independent Panel. Victor, over to you.
Thank you, Beth, and good morning, good afternoon, good evening to everyone. Welcome. Today, I have the privilege of addressing you as co-chair of the G20 High-Level Independent Panel, and certainly my pleasure to welcome you to the launch of panel's new recommendations and report. Let me begin by expressing my deep appreciation to South Africa G20 Presidency for reconvening the High-Level Independent Panel, or HLIP, at this very important moment. South Africa Minister of Finance, Gondegwana, called these recommendations a roadmap of actions for next year's UN high-level meeting on pandemic prevention, preparedness, and response. And we're certainly very pleased with his comments and pleased to share findings with you today. Following my opening remarks, you hear from my fellow co-chairs who present an overview of each recommendation. Then we move to two-panel discussion to reflect on the proposals, explore insights for implementation, and the steps going forward. As I get started, we're so pleased that we are joined by Dr. Ngozi Okonjo-Iweala, who's the Director General of the World Trade Organization. Now, she's joining us through video because she's indisposed at this point. She is a major valued member of the G20 High-Level Panel from its very inception. She acted as co-chair of the panel in 2021, and now she's a member of the panel. So let's hear from Dr. Ngozi.
Dear Victor, Excellencies, colleagues, distinguished members of the panel, greetings from Geneva. I'm honored to welcome you to the launch of the report, Closing the Deal, Financing Our Security Against Pandemic Threats. As a former co-chair of the High-Level Independent Panel, I'm proud to stand with those who have kept pandemic preparedness high on the global agenda. This launch is a timely reminder. Even as memories of COVID-19 fade, the risks have not. 4 years ago, the panel made a clear case for a global deal to protect our shared future. Today, your assessment is clear. The world is still exposed. Financing is slipping just as new biological risks emerge. Global priorities shift and technology advances. We cannot let a sense of normalcy distract us from realities that demand attention and investment. Yes, we made progress during these 4 years. The G20 Joint Finance and Health Task Force and the Pandemic Fund show multilateral cooperation is possible. But the gap between ambition and implementation remains wide. Many governments have not yet integrated preparedness into their domestic budgets. Access to medical countermeasures is uneven. Development banks lack tools to move at crisis speed. These gaps carry real consequences, and they limit our ability to detect threats early and protect the most vulnerable. The economic case is stark. COVID-19 wiped out trillions in output and cost hundreds of millions of jobs. As noted in the report, future pandemics could impose losses of more than $700 billion every year. Prevention will always cost less than recovery. The panel's recommendations give us a practical path. First, government should increase domestic investment, offer incentives beyond official development aid, and ensure accurate tracking of these efforts. Second, the International Finance Corporation and other institutions should provide support to accelerate the diversification of regional manufacturing capacities. Third, development banks should facilitate at-risk financing to enable the purchase of promising medical countermeasures. Fourth, we must strengthen innovation, manufacturing, and scale up for diagnostics, treatments, and personal protective equipment. Finally, securing sustainable support for the pandemic fund is essential. All these are achievable steps, but they require discipline, political will, and cooperation across finance, health, security, and development. And here's the bigger picture. The trading system is facing its worst disruptions in 80 years, and geopolitical tensions are high. The environment for trade is difficult, and that makes cooperation even more essential. In times of strain, multilateralism is not a luxury, it's a lifeline. At the WTO, we have seen how trade reinforces health security. Supply chains matter as much as scientific breakthroughs. Transparency matters. Predictability matters. During COVID-19, shortages were not just a health issue, they were a trade issue. If we want vaccines, diagnostics, treatments, and PPE to reach people in need quickly, markets must stay open, information must flow, and regional manufacturing must scale without delay. We should also look ahead to technology. Artificial intelligence can help detect outbreaks earlier, model risks more accurately, and deliver care more efficiently. It can strengthen surveillance, support regulators, and accelerate vaccine development. But these benefits will not materialize on their own. They depend on investment in infrastructure and skills, and clear rules that give countries confidence to use AI safely. If we can get this right, AI can raise health system efficiency everywhere and close long-standing gaps in preparedness. The WTO stands ready to contribute. Our work on trade-related aspects of AI, regulatory cooperation, trade facilitation, intellectual property, and reducing bottlenecks in supply chains for essential medical goods can support the goals in this report. No single institution can close these gaps alone. Together, we can build a system that is more resilient and more equitable. Above all, we must look ahead. The next UN high-level meeting in 2026 is an important moment to lock in commitments, but action cannot wait. The cost of inaction grows every day. Budget cycles are tightening, yet this is when clarity and resolve matter most. Investment in preparedness is an investment in stability, prosperity, and human security. Let me thank the panel for its leadership and unwavering commitment. The WTO will continue working with the G20, with international financial institutions and all partners to help turn these recommendations into meaningful progress. The world has the knowledge, the tools, and the experience. What we need now is focus and follow through. If we act decisively together and early, we can take pandemic threats off the table. That is a goal worthy of collective effort, and it is within reach. Thank you.
Thank you. Thank you, DG and Gozi. Clear message about the need for action. And let's not forget all the things we've been faced with and what we need to do in the future. Take the pandemic off the table, as you said. Strong statement supporting the work of the HLIP and its recommendations. So thank you indeed. Now we will hear from DG Tedros shortly after the initial segment of the recommendation of the presentation recommendation. So let me therefore turn over to panel's findings and recommendations. Can I have a slide on, please? So I'm joined today by my fellow co-chairs, Dr. Jane Houghton, Dr. Jean Kaseya, Dr. Benedict Orama, and Dr. Jan-Ane Rottingen. We stand here on behalf of the entire high-level independent panel, serving in our independent capacities. Today, we want to provide you with the new recommendations that we release. We actually presented our fund recommendations and report to a G20 Finance and Health Ministers meeting 2 weeks ago. We released them publicly online last week, and of course, we got already tremendous amount of support and positive reactions. Today, after we finish what we found, we invited some panelists, as I said, and colleagues to comment on our work, and most importantly, what are the next steps to implement the actions. Next slide, please. So back in 2021, during Italian G20 presidency, the HLIP was first convened to rethink how we finance global preparedness, even while we were very much in the midst of a COVID crisis. The 2021 report provides a series of actionable solutions and investment to meet the challenge of an age of pandemics and avoid repeat of damage that COVID-19 brought. Next slide, please. So what you see here are the essential findings of that report. First, governments should collectively commit to increasing financing PPR by $25 billion over 5 years, with sustained investment to follow. Second, establish a global threats fund of $10 billion a year to catalyze action. Third, to establish a global health threats board to bring together health and finance leaders, including ministers from G20 countries and head of regional organizations. So these were really important findings. And I think related to this is the launch of Pandemic Fund in 2022 by the G20 Presidency of Indonesia, hosted by World Bank. And today it's received $3 billion in pledges and not quite $10 billion a year, but has leveraged significantly a 7-to-1 average in matching funds. And also the G20 launched the Joint Finance Health Minister Task Force at the Italian G20 Presidency 2021. Next slide, please. Now, as you know, much has changed. We certainly seen that during the time we are meeting today at a moment of profound disruption in global health and health security. Today's turbulence stems not only from pandemics, climate shocks, geopolitical instability, massive cuts back in ODA, but also structural changes in our global health architecture. Same time, the drivers of pandemic are rising. Epidemics are occurring at much higher frequency with more severity, broader potential global impact. So we now know that pandemic of tomorrow is not a theoretical risk. It can happen anytime. However, despite these rising risks, countries are still grossly underinvested in pandemic preparedness and response. After every major biological crisis, from H1N1 to Ebola to COVID-19, the world spends billions to pick up the pieces at a major price: lives lost, downturns in travel and trade, and severe economic decline. By contrast, in other areas like defense spending, governments are generally much more willing to advance, for example, to avert conflicts and wars. So with economists estimating very high level of loss from future pandemics, investing to reduce pandemic frequency impact is an imperative, as we can anticipate high rates of return for these investments while saving lives. Next slide. So this year, given the disruption in health, security, and financing, the panel was reconvened by the South Africa G20 Presidency to provide practical, bold, and actionable recommendations to move us forward. Next slide. So this shows you the makeup of the panel. In fact, the panel has 50% returning from original group and 50% new members. We're supported by 2 working groups to prepare recommendations in 2 main areas. First, medical countermeasure search financing, and second, preparedness financing, including domestic resource mobilization. You can see in this slide, there's a picture of the Lancet paper we published on this particular report as a summary of this report, which has also been released last week. So what do we find? Next slide. Overall, HLIP identified 5 major gaps for pandemic PPR financing and 5 corresponding recommendations. Let me share the major gaps here. First and foremost, with ODA declining, there's a need for more domestic financing and also non-ODA sources of support. Second, there aren't sufficient financing mechanisms for access the meta countermeasure in surge manufacturing. And third, there isn't sufficient clarity for incentives for at-risk financing from the multilateral development banks and other public development banks during health emergencies. And fourth, test, treatment, and PPE have been under-prioritized despite being essential at the start of a crisis. And finally, pandemic fund isn't sufficiently capitalized or sustainably capitalized, and this work needs to focus on catalyzing domestic resources. So those are the 5 major gaps. Next slide. So to address these gaps, the panel developed 5 target recommendations, summarized in this slide. First, unlock domestic resource mobilization, mobilize health, security, and non-ODA funding, and track these results rigorously. Second, accelerate geographically diversified access to MCMs. Third, enable development bank at-risk financing for MCM advanced purchases. Fourth, operationalize financing for tests, treatment, and PPE. And fifth, strengthen the pandemic fund, its financing speed and scale, and cement its role as the world premier preparedness financing facility. Along with recommendation, we have identified 3 minimum financing benchmarks that can be tracked. Jane will outline these in a few moments. But importantly, all the recommendations have a timeline to be executed in time for next year's UN high-level meeting on pandemic PPR. So with that background, I'd like to turn over to my fellow co-chairs to provide with you an overview of each of the recommendations, next step for implementation, and any additional perspective on the report overall. So may I first start with Jane. Jane Halton, as you know, is the chair of CEPI, chair of IHME, and previous finance minister. And I'll ask Jane to give you the first recommendation. Jane, over to you.
Thank you, Victor, and acknowledging all colleagues who've joined us. Let me start, and you've already raised this, Victor, by actually highlighting that these recommendations are actually concrete and provide an operational roadmap for progress in terms of how we actually prepare for pandemic preparedness in terms of biosecurity more broadly as well over this next 6 to 12 months. And I do think this week has given us a really good reminder of why this financing agenda is really important, not only for regional security, but of course, global security. We've got a Marburg outbreak in Ethiopia, and of course, H5 influenza leading to a hospitalized patient in the United States. For our first recommendation, I want to highlight 2 points. The first is that we have to find better ways to incentivize domestic resources and non-ODA spending. Preparedness isn't just an ODA issue. What we've come to realize is many governments don't really understand where the funding from pandemic preparedness is going, and nobody is really tracking it properly. That's why we are proposing for this coming year of the UN high-level meeting, the government should focus on this deliverable, a costed and prioritized plan for financing these most important health security gaps. To track progress, we're also proposing a minimum annual financing benchmark for pandemic spending. And this has got 2 components. The first of which is we're asking governments to invest a minimum benchmark allocation of 0.1 to 0.2% of their annual gross domestic product towards pandemic PPR. Now, second, this spending should be complemented by benchmarked allocation of at least 0.5% to 1% of security and defense budgets, particularly from G20 and other high income and upper middle income countries. And this would be specifically allocated to biosecurity, biosurveillance, and the 100-day mission. Now, I do think we should underscore this because defense budgets across NATO and other countries are rising, and governments should be accountable for biosecurity spending. And in particular, we would propose that this spending would actually underscore and support deterrence, operational resilience, and of course, respond and hopefully prevent the deliberate and accidental misuse of biological agents, both at home, but of course, this extends globally. And our third and final recommended benchmark is to underscore the High-Level Independent Panel's previous call for at least 15 billion annually in international financing for regional and global public goods to fight cross-border threats. Alongside the benchmarks, we propose investing in better data and launching a global pandemic spending tracker next year. And this would be in time for the UN high-level meeting in order to identify better data and accountability so we can rigorously track results. Now, I didn't acknowledge some of our panel members before, but a couple of them have rightly and consistently prioritise what we're calling for, and David Miliband in particular has done this. We need the development banks to act now to develop a financing vehicle that can directly fund civil society and non-governmental organisations in places where governments lack presence or capacity to promote effective PPR, and that's through development assistance and other grants. Finally, in terms of other areas of the report, I'd personally highlight, and I think I'd like to stress this, the importance of surge financing for medical countermeasures. And this really draws from our experience in COVID-19. And this would focus on countermeasures for delivery. And I know John Cassay is going to talk to us about this. And those development banks and development finance institutions need to accelerate geographic and regional diversification of manufacturing. And of course, at the same time, we need philanthropies and other private sector actors to assist with blended catalytic financing and to stress test all of these preparedness capabilities, including annual live fire exercises. Finally, of course, and I really would like to underscore this, the pandemic fund, we need to make sure it's sustainably resourced, and we're calling on the World Bank and other development banks to create a sustainable allocation to underpin the fund so that it is less reliant on ODA, which of course, as we know, is shrinking. So let me now turn over to my good friend and colleague, Jean Cassay. Over to you, Jean.
Thank you so much, Jane and colleagues. Let me turn on the recommendation 2 and to drive you to what this group discussed about accelerating geographically diversified access to medical countermeasures. In the early months of the COVID-19 pandemic, a few production hubs dominated supply of vaccines, tests, treatment, and PPE. Export bans and bottlenecks left many low and middle-income countries and regions at the back of the queue. In an age of rising pandemic risk, this concentration of capacity is itself a vulnerability. Medical countermeasures are only as effective as our ability to get them quickly to every region that needs them. That requires not only science and manufacturing, but also reliable source and surge financing that can move at the speed of an outbreak and reach producers across all regions. Our proposal is practical. We call for IFC and other development finance institutions to partner in launching at least one dedicated, blended MCM surge financing facility. This facility will sit ready in peacetime and switch on in crisis, rapidly deploying capital to manufacturers to expand and repurpose capacity when a new threat emerges. By blending public, philanthropic, and private finance it can take on higher risk and crowd in much larger investment where it's needed most. To make this work, every region should have at least a standby list of qualified manufacturers and pool procurement mechanisms. That means clear criteria for which firms can receive such financing, what product they can rapidly pivot to, and how their input and output will be purchased and distributed. It will create this predictability for manufacturers, confidence for investors, and mostly, and the most important one, timely access for populations. Philanthropies have a critical role to play. We are recommending a dedicated window to finance technical assistance, market assessment, and stress testing of this facility and its partner manufacturers. That support will ensure that when the facility is triggered, it is deploying into a pipeline of viable, quality-assured opportunities rather than designing solutions in the middle of a crisis, as we have to do on more regular basis. This recommendation builds on the ongoing design work under the MCM Search Financing Initiative with a clear goal: a fully deployable facility by 2026. We can achieve that. If we act now, the next time the world faces an emerging pathogen will stop being scrambling to invent ad hoc mechanisms. We will have a tested, regionally inclusive system to finance the rapid scale-up of medical countermeasures where they are needed. Excellency colleagues, accelerating geographically diversified access to MCM is central to the global security. And recommendation 2 is our roadmap. Our roadmap because we strongly believe that this is the way to move forward. Therefore, we are calling the G20, the development banks, the philanthropic partners to move quickly from design to implementation so that together we can close this critical gap in our collective defenses. Let me now hand over to my colleague for the third recommendation.
Thank you very much, Jean. I want to start by underscoring what Jean Kasaya said about the importance of a regional mechanism for surging manufacturing. There has been a lot of discussion about regional manufacturing. As important as it is, we realize that it will take time to achieve. That is why in recommendation number 3, we are recommending additional practical steps. First, in addition to such financing for manufacturing medical countermeasures, we also must ensure that countries can also access concessional loans to procure countermeasures more quickly and at scale. During the COVID-19 pandemic, low and middle income countries weren't able to borrow money from the World Bank and other development banks to procure medical countermeasures at risk before they received regulatory approval. That is why our third recommendation is for the World Bank, all multilateral development banks, and other public development banks to fully enable pre-negotiated, rapid, and effective at-risk financing for advanced purchases of medical countermeasures by low and middle-income countries during epidemics and pandemics. As part of this recommendation, we would like to see the World Bank negotiate a memorandum of understanding to end pandemic with chief executive officers of leading medical countermeasures manufacturers in each region to pre-position indemnity and liability protection for manufacturers, which they require for advanced purchases, and establish a template advanced purchase contract for low and middle income countries. We are also concerned that the pre-qualification process for countermeasures that are already approved by a major regulatory authority moves slowly. That is why we are asking for a process where those products can receive a temporary or provisional approval until WHO pre-qualification reviews are completed in order to speed the response. Finally, we believe that all regions should have a revolving fund, just in the form of the one by PAHO, the Pan American Health Organization. I will now turn it over to Jean-Annie to outline recommendation number 4 and number 5. Thank you.
Thank you so much, Benedict, and thanks also to my fellow co-chairs for really embarking on this endeavor together. Before I go to the recommendation 4 and 5, I would like to really emphasize that the commonality that already Victor has alluded to between the first report from the High-Level Independent Panel and this report is stark. We are more focused maybe on some of the recommendations this time around, and we are really emphasizing that both global and regional public goods are vital for stopping outbreaks early and for mitigating the harms from pandemics. We also know very clearly that investments in pandemic preparedness and response, they have a high rate of return for economies and for saving lives, yet, as we probably have seen across many countries of the world, the political will to really invest in this area is unfortunately declining the longer we get away from the COVID-19 pandemic, and it shouldn't be like that. So we have a lot of work to do, and we believe that is why it's so important with this second report from the High-Level Independent Panel to have a roadmap of very practical and concrete steps. I'm myself personally very excited about using this report and these very concrete and implementable recommendations to drive a more specific agenda towards the UN high-level meeting on PPR that will happen in September. I hope that we can make more progress in each region on capacities that won't only rely on sharing, which can come far too late, as we saw in the COVID-19 pandemic. But then I would go and talk briefly on each of the recommendation 4 and 5. So start with recommendation 4. As a group, we felt strongly that while we still have a long way to go to achieve the 100-day mission goals for vaccines, we are definitely in a better shape there and gradually improving. But we have an even further way to go in many ways from achieving these goals or this goal for tests, treatments, and PPEs. We need these products very early in a health emergency, as well as R&D needed for products that are more accessible and easier to distribute and use in different geographies and regions. And that's why one of our key recommendations here is asking regional and global organizations to really designate specific anchor institutions that will develop and scale tests, treatments, and PPE, and at least coordinate and take leadership in these spaces, and launch a clear financing strategy to deliver this mission already in 2026. We are also calling for the establishment of at least one PPE manufacturing hub and stockpiles for those in each region, and that regions need to come together for this. Alongside critical investments in MCM surge capacity, research and development, investments are also needed in platforms and other technologies to increase efficiencies and reduce the cost of MCM production and make sure that we are ready to really address a new pandemic when it will happen, as we know, sometime in the future. So that's recommendation 4. And then please next slide for recommendation 5. So finally, the high-level independent panel strongly supports strengthening the pandemic fund, already highlighted by other colleagues, and really cementing its role as the world's premier preparedness financing facility. We know it won't be easy, but we think it's crucial that the World Bank and other development banks commit to establishing standing renewable allocation to ensure sustained support for the pandemic fund and its work. We have also provided clear recommendations for how the fund can be even more impactful. And in particular, we support the fund's work to secure agreements with MDBs and to support even more work through them to help countries with domestic resource mobilization and prioritization alongside the support from the Pandemic Fund and MDBs. We would also like to see the fund move to a more flexible rolling model of proposals so that it can be more nimble and to require in addition matching funding from countries and from new partners, including from non-ODA financing sources as well as biosecurity funders. Finally, we'd like to see the fund continue to prioritize work in fragile settings and secure civil society organizations, non-governmental organizations as direct implementing partners for areas where governments cannot reach. This is crucially important because we know populations in those vulnerable settings are definitely also needing support, and they are hard to reach. I'd also like to take this opportunity to say more generally that I really think the recommendations surrounding the MDBs are crucial, and we've also heard this from Benedict, Jane and Sean, that because they can be executed quickly through the balance sheets and the capabilities of MDBs. Because we all know that the next catastrophic pandemic can come at any time. So we need to make the fiscal space available now in order to be ready. MDBs are among the best ways to do that in the very short term, while countries are gradually building their budgets over the next couple of years. Because we know the pandemic risk doesn't wait. Thank you. So back to you, Victor.
Victor, you're muted.
Thank you. I say thank you, Jan and Nate, and thank you to all the co-chairs. I said how much I enjoy working with all of you and being able to deliver this report. I also want to thank the entire panel for their work, as I showed you earlier, but also the 2 working groups. Each one consists of about 20 people, so there's been a lot of work putting this together. And of course, Beth Cameron, who is the Secretariat special advisor to us, who's been a major driving force behind this. So where we are now? Well, guess what? The time is now. We stand ready to work with the partners around the world to accelerate the implementation of recommendations in advance of 2026 UN high-level meeting on PPR. So please read the recommendations and work with us. Support us, and you're the ones who can make things happen. Help build and maintain momentum for implementation. We're going to go forward working with G20, the Joint Finance Health Task Force, and all other relevant actors to bring this regulation into reality. We also convene at least 3 meetings in 2026 in advance of the high-level meeting at UN on pandemic PPR. Next slide. Well, guess what? What I'm going to show you is actually a lot of excitement in social media and, of course, in getting direct feedback from ministers and others. First, from President of EC, Ursula von der Leyen, who thinks this is really important, a bold vision, and it reinforces the global commitment and welcome implementation. CEPI said, yeah, absolutely. Jane Houghton, for example, who chairs this, says we want urgent action, needed closer financing gaps. And my good friend Jean Cassé, who just spoke, say together with partners like Pandemic Fund, and Africa, also emphasize Africa is a co-architecture of all these things. And of course, we're so excited with all the positive responses that we're hearing everywhere. So with that, I'm going to see if now DG Tedros have joined us. I guess not yet. So with that, why don't I move forward, therefore, with the next part of the meeting. First, the first panel to get their reaction to recommendations. This panel includes Dr. Mamta Murthy, the Vice President for People at the World Bank, Dr. Rachel Genster, the President of Center for Global Development and a member of the HLIP, Mr. Patrick Olomo, Head of Economic Policy and Sustainable Development of the African Union Commission, and of course, Dr. Seth Berkley, Senior Advisor to Brown Pandemic Center, former CEO of Gavi, and also a member of the HLIP. So if I may ask four of you to turn your cameras on and join me on screen and ask you one question. From your perspective, what are the most critical areas of the report? How can they be rapidly implemented, particularly in time for next year's UN high-level meeting on PPR? Mamta, let me start with you.
Thank you so much, Victor. I was struggling to find the mute button. It's a great pleasure to join everyone this morning. And I really want to thank the High-Level Independent Panel for another exceptional report and for keeping pandemic PPR, if I may use that acronym, at the top of everyone's agenda. Now, I guess I just want to say a few words about the context before I respond to your questions. I think it's really very unfortunate that health spending, public health spending, is actually declining in many low and middle income countries. And this at a time when health needs are actually growing and pandemic risks are rising. Last year, we launched a target as the World Bank Group, working with partners to reach 1.5 billion people with health services by 2030. And we feel that this target has become even more important in a context when health systems are being weakened, including by a decline of external assistance. Now, in that context, I think there are three areas which, to my mind, the three recommendations that made by the HLIP, which really resonate with us and where we will continue to work. The first is increasing domestic resource mobilization for health and PPR. The second is expanding local access to medical products, particularly in underserved geographies. And the third is enabling at-risk financing for medical countermeasures. Let me just say a few words on each. And I'm going to talk about what we are doing in this space, because I feel we are an important part of helping deliver these recommendations rapidly. So on domestic financing, we're doing a lot of work in helping countries expand fiscal space, but also in implementing health financing reforms and other health reforms to increase domestic resources for health and target them on the highest priority interventions. We do this as a part of our regular policy dialogue, but we're enhancing this under our 1.5 billion target. We are also changing the incentives within our organization to support PPR investments. Sorry, my voice is a bit bad today. Let me just talk about two of these incentives. First, we have a special window under IDA 21. It's called Global and Regional Opportunities Window, and it's really focused on these global and regional public goods, and it incentivizes countries by providing additional grant resources for PPR investments. We also have something called the Framework of Financial Incentives. This is for IBRD countries, and this too incentivizes countries by giving them lower rates, lower interest rates if they invest in PPR capacities, because PPR is a public good. We are an implementing entity of the Pandemic Fund, and so we also help countries draw upon Pandemic Fund resources and help them implement those grants. I want to give a shout out to the Pandemic Fund. We are huge fans and backers of the Pandemic Fund, and we really hope that they can raise more resources. Now, the second area I want to talk about is local access to essential medical products. And this is a very important enabler of our 1.5 billion target. So we are specifically working on this in sub-Saharan Africa. We will launch next year something called Initiative for Medical Access and Manufacturing in Africa called AIM 2030. And the whole idea of this is to support African manufacturers through a one-stop shop of blended finance and technical assistance, which will create a baseline portfolio of sustainable manufacturers who can surge in the time of an emergency. Now, it's not just about investments in these companies, it's also about addressing regulatory and trade barriers, skills availability, demand predictability, supply chain issues, and so on. And this initiative is designed to be holistic and to address all of these other issues that can support local manufacturing. You should also know that IFC signed last year a memorandum of understanding with other partners to collaborate on working capital financing in the event of a future pandemic. So that's on local access to essential medical products. And I really hope we can partner with others on our AIM 2030 initiative, which, as I said, we will launch next year at the margins of the AU Summit. Finally, on at-risk financing of medical countermeasures, and I see Seth on the call, and this is something that we discussed at length during COVID-19. I'm really happy to say that we're exploring options for how the World Bank can be a source of at-risk financing in the event of a future pandemic, as well as play a role in sourcing health products itself. And this is an area that we have not been in before, and it would require considerable discussion with our board, but I'm very happy that there's openness to have this discussion. More broadly, we are also expanding and strengthening our different instruments for crisis response. And this includes a crisis preparedness and response toolkit, which can provide countries with fast access to cash during emergencies, and that would include health emergencies. So in short, there's a lot going on our side, which would support the recommendations of the HLIP. But I really want to echo Ngozi's words. I think that we have to work together. No one institution can solve the problem. But I believe that with shared commitment, we can move forward in a sustainable way and in a forceful way. Thank you.
Thank you, Mamta. Thank you so much for all that you do at the World Bank, and that's your support of this report, because we need you to solve some of the problems and implement the recommendations. So let me go to Rachel. Rachel, so what are the most critical areas from your perspective, and what about the recommendations?
Thank you. And it's been a pleasure to be part of this panel and really see some important progress here. So I'm particularly interested, committed to, think it's very important to work on recommendation 3, which is about the at-risk financing, which Mamta talked about. The reason I think it's so what it does is it enables the World Bank and other development banks to make resources rapidly available to low and middle income countries to purchase countermeasures, including vaccines, diagnostics, treatments, even before these countermeasures have gone through regulatory approval. And that is what rich countries did, what they were able to do. I was working in the UK government at the time during COVID, and we purchased at risk, i.e. we purchased long before regulatory approval. And I was advising low and middle income countries to do the same thing. I remember being on a Zoom call with Seth as we talked about this very, very early in the pandemic. And the reason is it's highly
it's a highly effective way to get to the front of the queue, and also to increase supply of vaccines and other countermeasures. So analysis shows that 60 to 70% of the delay in getting vaccines to low and middle income countries during the pandemic was due to later purchasing. Almost all low and middle income countries purchased after countermeasures had got regulatory approval. And there are reasons for that. There are barriers that we assessed as part of this group. And this is what recommendation 3 is about, and other recommendations are systematically going through the barriers that we faced before and making sure that they're reduced. So now pandemics have huge economic costs. And if you look at the frequency of pandemics and the economic costs once they happen, on average, you should expect pandemics to cost the world $1 trillion, at least $1 trillion every single year going forward. So it's really worth putting a lot of resources available to low and middle income countries to be able to act fast. And multilateral development banks made huge resources available during COVID to address the economic shocks, but they were slower in being able to get money to middle-income countries to access countermeasures. So that's what we're trying to address here. And it could save trillions of dollars and millions of lives if we can get responses faster. So the recommendations here are very detailed and they're very practical. And I'm very grateful for the deep engagement from colleagues from these institutions, so that the recommendations we are making are absolutely feasible within these institutions, right? But people in the past have made some recommendations that don't fit with how these institutions work, but these are absolutely doable. And the prospect for getting them through, I think, recommendation 3's key recommendations are very good, right? But we will only get them through if we continue to put pressure on the organizations to get them through, because they have a very busy agenda and we have to keep this top of their agenda. And I call on, in particular, low and middle income country governments to say this is a priority, because they need to hear it from you. And we will get this through, hopefully, in the next year. I want to make one small point on recommendation 5, which I think is really important, which is on innovation, and how the Pandemic Fund can do more to promote innovation through the Pandemic Fund. An example would be testing filters in schools to see if they reduce the spread of respiratory diseases. We can do that before the next pandemic, and then we're ready to go during the next pandemic, which is a question of when, not if, I'm afraid. Thank you.
Thank you. Well said, Rachel. Really excellent. Let me turn to Patrick. Patrick, I mean, you have lots of experience, certainly from Africa's perspective. I've heard you talk about this before. Tell us now, what do you think are critical areas?
Thank you very much, Victor. And I would like, first of all, to appreciate the panel for the excellent report that is released today. What I want to say is that we are certainly at a very critical moment in time, because, as was said by the previous speakers, the next pandemic is across the road, and it is just a matter of time to be facing it. For us, the recommendations of the panel are extremely important. Those recommendations are important because they are addressing some of the critical challenge that we are facing when we drive our road towards sustainability and towards growth and transformation. It is much more important for us, first of all, on an African perspective, to understand that development is a do-it-yourself process, as we have already been saying in our, in presentations when we speak at the African Union. That is why this year we convene a ministerial meeting, a joint ministerial meeting between ministers of finance and ministers of health in South Africa to discuss in the framework of the G20 how we can better support pandemic preparedness and response, and also how we can equip the continent with the right health systems that are going to address and preserve us from being, affected by the next global pandemic in case it happens. In that perspective, our ministers have committed to support this process through enhanced domestic resource mobilization. And I do believe that this is the way to go to make sure that we, work in the framework of the Abuja target, which is to allocate 15% of our budget to the health sector. And in this perspective, they have renewed their commitment and they have firmly decided to work together between ministers of finance and ministers of health and central bank governors even to see how we can better support the continent moving forward. But having said this, they also called for international support because pandemics are not only the fact of one continent or the fact of one side of the people who should be affected. It is a global problem that should be conceived as a global public good. And in that perspective, we do believe that the support of the international community is extremely critical. This speaks to the support that the international financial architecture should provide in support of Africa's development and Africa's sustainable handling of health issues. And in that perspective, it is important in the framework of IDA 21, as was said earlier, to see an increased amount of resources that will be allocated to pandemic preparedness and response. The pandemic fund is also a critical instrument because it will allow the global response to be much more effective and to be targeting issues when they are arising and even anticipating those issues, because it is important as we move forward to equip the continent, Africa, for instance, with the productive capacities that are going to allow to unlock the potential of the health system. As we are looking forward to see an increased amount of medication that are manufactured in the continent to avoid being exposed to shocks as we were exposed during the COVID-19 pandemic. This is critical because without industrialization and without productive transformation in the continent, we are going to be subject, to the disruption of international supply chains. And the consequences of that are huge in terms of the spread of the pandemic, as we saw during the COVID-19 and even in other pandemics that are still ongoing. It is therefore important that international efforts be deployed to make sure that we address collectively, make sure that we create a space for and support people as we move forward. For the African continent, as we said, it is not for us a call for charity, but it is a call for, for global justice and for global understanding that the problems of one continent are not only affecting that continent, but they are global problems. Let's be reminded of the fact that during the COVID-19 pandemic, borders were no longer working because the spread of the pandemic was, beyond what we could do to try to contain it. So it is important to have a global response that works. And I do believe, and this is the position of the African Union, we do believe that the implementation of all the recommendations of the report will certainly lead us to something, to sustainability and to strengthening the health system, across Africa and across the world. We do count on the international support to make sure that we move in the right direction with the implementation. Let's move from words to practical actions that are going to address the challenges that we are facing. That is what we can say for now, but we do believe that the report has a huge potential and that it is high time for us to move towards implementation of those recommendations. Thank you, and over to you, Victor.
Thank you for your strong support, and we rely on you to help us implement many of the issues. Let me turn to Seth, my good friend.
Thanks, Victor, and it's a great honor to be here with all of you. Everybody said it, but I want to say it again, which is the risk of epidemic and pandemics continues to rise, and we are not prepared. And I think it's also important to say there is no such thing as global security without global health security. And it's one of the important things in the panel to discuss, which is what Patrick said is right. We need a global response. We also need national responses. We need not just ODA responses, but we need defense responses, et cetera, because we have to think about this as a combined threat that needs a strong, well-planned response and prevention going forward. I also want to emphasize what Patrick said about the health system. The delivery of vaccines, which of course is the area that I know the most, was delivered mostly through existing health systems. So strengthening those health systems in peacetime, and Mamta talked about the work that the bank is trying to do that, is absolutely critical. The work that was done to create better cold chain, to reach zero-dose communities, et cetera, all builds up that system, and that needs to be seen as not just important for those individual people, but also as part of this global system. Now, the things that, in my perspective, are most important here were the challenges we had in the past pandemic. The first was an understanding, not a lack, I should say, a lack of understanding about the importance of risk in a pandemic. If we think about it, the average success rate for a normal vaccine is about 7 per 100. And of course, in this case, we had a lot of investments in understanding how to make coronavirus vaccines, and that's why most of them worked. But if you want to move fast, you've got to start the technology transfer work, you've got to start purchasing vaccines, and you have to do that at risk. And of course, we set up COVAX to do that. And of course, we had zero money, zero people, and zero mandate, and we had to build all of that. At the end of the pandemic, we went back and built a zero-day financing facility capitalized by $500 million, which I think should continue to be replenished. But one of the challenges, of course, is donors don't like money sitting, in a fund and not being used. And that's why this idea of being able to bring in the world's financing institutions, the multilateral and public development banks, to be able to do this is a very good idea. But to do it, they have to take on the risk and be able to deliver in time, quickly, and be able to deal with it. So the report talks through what that would entail, and I'm really excited to hear that the bank board, and staff are considering moving this forward. Of course, there were many other important pieces in the report. The idea of expanding manufacturing, that is not only important in terms of plants, and by the way, vaccines are much better off than are diagnostics and drugs and PPE, and that's why the report emphasizes that they need a special push. But we do need to make sure that there's adequate facilities, but what's important is going to be the transfer of technology, the supply chains that go with that, and Ngozi talked about that at the beginning. Without that, facilities won't be able to move forward. On vaccines, we're in better shape than we were. There's a lot of capacity now in the developing world. Whether it stays there is not going to be clear, and I think this is an important issue. And lastly, the issue of financing. It isn't only global funds, it's national funds, and therefore knowing what is being spent and having some targets there that we can look, working with countries at both for their domestic funding, but also their defense budget, I think is a really important issue that is there. And just to call out again, the work during the pandemic and afterwards, we had challenges with the speed of approvals, and we believe that if there are approvals in high quality regulatory agencies, that there should be provisional or temporary approvals, so those cannot be delayed. So those are some of the issues that I thought were important, and I was delighted to be part of the working group to try to help put these together.
Fantastic. Well, let me thank all of you, the panelists, really outstanding. As I reflect on your comments, and reflect on the experience of HLIP, first one and second one, as involved with both of them, here's what I think. In HLP number 1, the recommendations were lay the foundations, if you will, of investment and governance, and in many ways set the stage, but didn't have the benefit of the learnings from COVID-19. This set of recommendations is a lot more actionable, a lot more detailed, more practical, so that we can now move forward with all these aspects: risk financing, surge financing, domestic resource mobilization, banking fund, and MCM, to be able to now get much more prepared, if you will, for, in fact, if anything happens the next time, and to do a lot more in prevention. So thank you again, panelists, for a great discussion. Let me move now to panel number 2, which includes Dr. Agnes Sukat, who is the head of Health and Social Protection Division at the Agency for Development in France, and Dr. Sinead Hall, who's Senior Advisor, Africa CDC, and a co-lead of the MCN Surge Financing Working Group, and Dr. Lisa Minura, Senior Advisor for the JLI Center for Global Health Diplomacy and former Director General of Health Policy, Ministry of Health of Indonesia, and Pandemic board member and member of HLIP. So if you guys all on screen, so I think the question is, how do these recommendations align with priorities of 2026? From G7 presidency of France to regional agenda. So let me start with Agnes first and see, how does France look at our report and how does it align with your priorities?
Thank you very much, Victor. Do you hear me well?
Yes, very well.
Thanks. First, let me commend the high-level international panel for this high-quality report. We really welcome the analysis and the high relevance of the recommendations, which provide both countries and partners with a truly practical way forward. We particularly appreciate the excellent analytical work that was conducted to inform the report, which is really based on science, which is a priority of France global health policy, and a careful analysis of the lessons learned during and the COVID-19 pandemic. We learned even more about what had happened during this pandemic, and it's been extremely useful. 3 salient points we would like to emphasize in response to your question. First, on financing, we really appreciate the message that PPR should not be limited to ODA. This really corresponds to the evolution of our development assistance strategy and our new focus on mutually beneficial partnerships. As a pure national and/or global public good, investing in PPR should be the step 0 of any health investments. And therefore, any investment, be it domestic or non-concessional financing, is actually warranted given the high return on investments. And some of the numbers have been given by Ngozi earlier. When you have this kind of returns on investment, financing doesn't need to be concessional. This is really the best investment most countries can do. We particularly appreciate within that message the focus on the 0.1% additional spending on PPR or reallocation of public money for PPR, but also the call on public development banks to join. And particularly, we are very convinced that all public development banks should join in looking at the possibility of financing this crucial agenda. And the Finance in Common coalition of public development banks that brings together more than 530 public development banks, including the World Bank and the Asian Investment and Infrastructure Bank, which are the biggest ones, but also the national banks like DBSA, the Development Bank of South Africa, and others. And together they mobilize about $2.3 trillion per year of public investment. And part of this should be really tapped in for this agenda. Second is also we particularly welcome the call to invest in regional mechanism, both for pool purchasing and procurement, but also for production of counter-medical measures. France is extremely attached to the agenda of sovereignty in production of medical products. We've been mobilizing together with the EU several billions over the past 2 years that have gone both directly to producers like Aspen in South Africa, but also to countries to develop their regulation capacity, but also their pharmaceutical policies and their industrial policy when it comes to pharmaceutical investments. So we also support AVMA in Gavi to help develop the kind of mechanism that would allow upfront financing of investments in the production, the local production of medical countermeasure. And finally, we also welcome the recommendations calling for the strengthening of the pandemic fund. We have observed how this pandemic fund, the way it is structured, is really the right way. Having a mechanism that incentivizes investments at country level, that brings together other financiers as co-financier, and allows to mix national financing, regional resources, and global concessionality in the form of these grants is absolutely the way to go. And I think the early experience of these past 2 years has allowed to identify also how the pandemic fund can evolve and how it can work better. And in this respect, the recommendations of the report are very welcome. So in link to that and talking about how this will affect how we're going to work in 2026, we actually, as a public development bank, the France Agency for Development stands ready to co-finance this agenda and work with the pandemic fund. We really think that one of the ways to improve the way the pandemic fund functions is by increasing its leverage and increasing its capacity to incentivize public development banks to invest. And the 530 plus public development banks are extremely interested in this agenda, as well as more broadly investing in the question of environment and health and building systems that are resilient. So linking the pandemic preparedness agenda to the planetary health agenda and One Health agenda, which is an absolute priority for France. And next year, on 7th of April, President Macron will host a conference, a One Health conference at presidential level in Lyon to further discuss how we can step up our efforts and our financing for the One Health agenda. So again, congratulations. This is a very important report that is really going to guide our action. And together with other public development banks, we really stand ready to contribute to this and to work both with the Pandemic Fund, but also with the partners, the regional partners, such as the Africa Union, ASEAN, and others towards this agenda. Thank you very much.
Thank you so much, Agnes. We look forward to the G7 presidency of France. We look forward to working with you. I hope the HLIP recommendation report will be part of your agenda. Thank you. Now, I have to say that Chanel and Lisa, we got very privileged that Tedros joined us. So if I can interrupt the flow and get Tedros DG of WHO, Tedros. So nice of you to join us. We've had a really good report launch, and I think you will cap it off by turning to you and make your remarks. Tedros.
Yeah, thank you, Victor, and thank you to all who have joined and your co-chairs as well, distinguished colleagues, dear friends. Sorry, first of all, apologies for joining you late. We were in that event of Global Fund replenishment, and it took longer than we expected, but it was a successful one.
Good.
Yeah. And I would like to thank South Africa, as well as to the HLIP co-chairs and Secretariat for bringing us together again. And I was pleased to join in person in Washington, D.C. When you had that meeting on the margins of the World Bank.
Yes.
And I think my thanks to South Africa for its leadership in reactivating the HLIP at such a critical moment for global health. 4 years ago, as you know, in the midst of the COVID-19 crisis, this panel released a groundbreaking report that the Foundation for Advancing Pandemic Preparedness and Response. First, it highlighted an annual financing gap of $10.5 billion that funding was instrumental in launching the Pandemic Fund in 2020. That finding was instrumental in launching the Pandemic Fund in 2022. Since then, over the past 3 years, as you know, the fund has awarded $885 million in grants across 75 countries, helping to mobilize more than $6 billion in additional public and private resources. WHO is proud to lead the technical work of the Pandemic Fund and to support countries in developing and executing their proposals. And second, again, thanks to you, the panel, the report called for stronger cooperation between the finance and health sectors. This contributed directly to the creation of the G20 Joint Finance Health Task Force during Italy's G20 Presidency in 2021. And these are two important issues, and that shows the panel has delivered, among other things. And that's why I was very appreciative of South Africa for reactivating the panel. And WHO remains firmly committed to supporting this task force through our technical expertise and by hosting its secretariat. The task force is continuing to expand collaboration between the health and finance communities and to develop tools to understand and mitigate the economic risks posed by pandemics. Important progress has also been made in the other areas of pandemic prevention, preparedness, and response. As you know, in recent years, WHO has launched several initiatives in direct response to the lessons learned from COVID-19. This includes the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, the mRNA Technology Transfer Hub in South Africa, the Biomanufacturing Workforce Training Hub in the Republic of Korea, the Global Health Emergency Corps, the Interim Medical Countermeasures Network, and others. And all these initiatives also benefited from the ideas that were discussed in the panel. So I wanted to really appreciate you for all the contribution you have made. You're also aware that WHO member states adopted a package of amendments to strengthen the international health regulations. And at this year's World Health Assembly in May, they adopted the WHO Pandemic Agreement, a truly historic achievement. Member states are now negotiating the Pathogen Access Benefit Sharing System, the PABS Annex, and we anticipate that these negotiations will conclude ahead of the next year's World Health Assembly, allowing the Pandemic Agreement to be ratified and to take effect as international law. Much has been accomplished, but major challenges persist. Many health systems remain vulnerable, as we all know. Low and middle income countries are facing rising debt, shrinking fiscal space, and reductions in development assistance. Since January, significant cuts in external health funding have made these challenges even more acute. Without timely domestic investment, essential services may be reduced or even stopped. In this environment, stronger coordination between health and finance is not just helpful, it's indispensable. We welcome the 5 recommendations the panel is presenting: mobilizing domestic resources, ensuring diversified regional access to medical countermeasures, providing at-risk financing for advanced procurement, enabling surge financing for diagnostics and PPE, and enforcing the pandemic fund. This agenda must be closely aligned with the pandemic agreement, embedding its financial and operational requirements into practice. We also support the panel's call to broaden financing beyond vaccines. No pandemic response can succeed without prompt and fair access to tests, treatments, and personal protective equipment. Looking forward, multilateral development banks have a crucial role to play in helping countries act quickly and equitably. Whether through global reserves, pool procurement, or regional platforms, our success should be measured by how effectively we reach the last country in need, not just the first. Dear colleagues and friends, for too long, the world has operated on a cycle of panic and neglect. We react to a crisis, but when it's over, we fail to learn to its lessons. After all, there is always a new crisis around the world. We must break that cycle. And that's why the panel's work is very important: to prepare, prepare, and prepare. And we ask the G20 countries and all countries to continue prioritizing pandemic prevention, preparedness, and response, because health security is economic security and social stability. Let us act with urgency, because as we all know, the next pandemic is not a question of if, but when. So while thanking you for your work again, because it will help us to prepare, I assure you that you have our full support and will support you in any way possible. Thank you, and Victor, back to you.
Thank you, DG. Those inspiring remarks. Thank you for your strong leadership during these very uncertain times. Thank you for your unwavering support for actions for pandemic PR. So thank you. We know that you have a very tight schedule. We truly appreciate you being able to come and support us. Thank you. So if I can go back to, in fact, the panel and now turn to Chanel, who can give us perspective of Africa CDC.
Great. Thank you so much, Victor, and to my co-panelists. On Monday, The Lancet published an article authored by Director General Kaseya titled "Africa's Health Security and Sovereignty Agenda, A New Way Forward," which lays out 5 pillars to achieve security and sovereignty. I really encourage everyone to read it. And there is just tremendous alignment between the agenda of the HLIP and the agenda put forth for Africa in that article. And maybe just 4 points to focus on. First, the HLIP's emphasis on domestic resource mobilization and the use of non-ODA spending for health security directly supports Africa's vision for sustainable health financing. You heard it from Patrick. Well, you've heard it from many on the panel and also the co-chairs. Africa's calling for expanding domestic fiscal space, innovative taxes, and blended finance to fund epidemic preparedness. And the HLIP echoes this by urging countries to mobilize internal and security budgets for PPR rather than relying solely on aid. Second, the HLIP recommendations to accelerate geographically diversified access to medical countermeasures and enable development bank at-risk financing for advanced purchase are directly aligned with Africa's pillar on regional, specifically African manufacturing and the African pooled procurement mechanism. And the recommendations help Africa advocate for financing facilities that channel resources through regional entities to support regional manufacturing and regional pooled procurement, which are both cornerstones of Africa's health security and sovereignty vision. Third, the HLIP's support to the further strengthening of the pandemic fund's speed, scale, and role is fully aligned. The pandemic fund is critical to Africa's PPPR priorities, and it's critical that the fund is supported and fully capitalized. And lastly, HLIP features DG Kaseya and Professor Benedict Arama as two of the co-chairs, symbolizing a shift in global governance and health architecture, where Africa co-designs financing solutions. And this amplifies Africa's voice heading into the 2026 UN high-level meeting on PPR. And this is the year Africa moves from commitments to instruments. Thanks so much, Victor.
Excellent. Thank you so much for a very strong message. Lisa, you were the former DG of Health Policy in Indonesia's Ministry of Health. So speak to us from your regional perspective. How do you see this report and how do you see this moving forward?
Thank you, Victor. I must say, it's certainly been a privilege to be part of this panel and the working groups that have consolidated voices and views from regions, including Asia Pacific and Southeast Asia. I can say that across regions, we can see resilience becoming a strong priority for 2026. This is true in our region, in Southeast Asia, where we see ASEAN integrating early warning systems and piloting joint procurement. We can also see in other regions, such as in Africa CDC is scaling genomic surveillance and regional manufacturing. PAHO and Latin America are expanding regional vaccines and diagnostics production. The GCC is harmonizing regulations, and the Pacific is also investing in shared One Health surveillance because the need is very clear. Regions are building shared system because no country can secure itself alone. Now, the HLIP fits these regional priorities because across the 5 recommendations, it answers 3 core questions that are essential for resilience, especially at the regional level. First, the question that HLIP answers for these regions is, what is the minimum level of financing the world needs to be safe? The HLIP makes the preparedness gap explicit and defines minimum financing benchmarks, including the 15 billion annual call for international financing for regional and global public goods to fight cross-border threats, including countries to invest at least 0.1 to 0.2% of their GDP in PPR, supplemented by G20 and other high and upper middle income country funding of 0.5 to 1% of their security and defense budgets. Now, regional systems such as those in Southeast Asia need reliable multi-year funding, and the HLIP sets the minimum financing required to deliver that. Second of all, the question that HLIP answers is, how do countries and regions actually mobilize this financing? The HLIP identifies the practical toolbox to meet these benchmarks. There's blended finance that countries like Singapore, for instance, is already pioneering, debt for development swaps, that Indonesia is having already 4 debt to health swaps, domestic resource mobilization, and at-risk financing through MDBs for tests, treatments, and vaccines. So there are those that are happening at the national level as well as global level, but regions can also apply them by pooling country resources and using regional development banks and MDB regional windows to finance regional platforms for manufacturing, procurement, regulation, and surveillance. Now, the third question that HLIP answers for regions is, how should the global architecture be structured so regions can act quickly and effectively? The HLIP, as we know, calls for more diversified implementing partners, clear roles among development banks, UN agencies, and regional bodies, surge financing mechanisms, and a more coherent global system that aligns national, regional, and global priorities. We're already seeing this shift that at the Pandemic Fund, we're engaging more regional entities, enabling multi-country and regional proposals, and supporting platforms that strengthen cross-border systems. Because regions need partners that are within their geography, can integrate systems across borders, and can move at outbreak speed. And the HLIP provides the extra architecture to support that. So from a regional perspective, the HLIP tells us what to fund, how to fund it, and how to align it globally. Because if regions are considered as part of the front line, then financing has to meet them there. Thank you, Victor.
Thank you very much. Boy, this is a great panel and what a great day. You know, let me just say in closing meeting, when I'm so encouraged by the comments of all of you, the panelists, because you know we, as part of the HLIP group, obviously put forward these, but these two panel discussions reinforce the idea that we are on track and there's a lot to be done. So a report is a report. We have a lot of work to be done going forward. As you know, we're aiming for the 2026 high-level panel to take this further. We have some benchmarks to be achieved. And of course, we are going to work with many, many of you all together forward. So thank you again. It's timely for me to close this meeting, given it's time, but I just want to thank all of you for being part of this really important launch. Thank you.
Thank you, Victor. Thank you.
Thank you.
Bye.